My practice here is called Osteopathic Vision, and I came back here after teaching for a year in California because of the Indiana Center for Advanced Medicine. They offered me the position here and gave me the bonus of being able to do my own practice when I'm not seeing cancer patients, which is absolutely wonderful. The thrust of my practice is osteopathic manipulative medicine. So that is hands-on treatment for really any kind of medical condition. Everything from treating infants straight out of the womb to helping old people pass on. I've done the full gamut. And I do the majority of it with my hands. I do use prescription medications occasionally. That's the basis of my practice. Now, my definition of success is having every person in Indianapolis as my patient and having an empty office. I'm really trying my best to get people well and to return their health into their lap so that they can work with it themselves. And I'm here to facilitate that. So for me, what that means is I'm trying to get you in and well in as few visits as possible. So when you show up for the first visit, we talk about strategy, and you get treated during your first visit after we do a pretty thorough history and physical examination. And then I really keep tabs on you, bringing you back about every 2 weeks. And for most people, whatever they come in with, it takes 3 to 4 visits to get that either resolved or, you know, in 2 to 3 visits, we're pretty sure we're not going to be able to put a dent in it. And so we're looking at who do we refer to be able to take care of that. Or, you know, in rare cases, there are things that I still haven't figured out yet. And so we continue to work with each other. But we're very upfront about, okay, this is where we stand and this is where we're trying to be. And so we bring in literally whatever works to be able to do that. So if that's coordinating with other physicians or non-physicians in the healthcare field, doesn't matter to me as long as it works. I'm trying to get the patients well. In doing that, what I've found is that people need some help many times in order to be able to heal. So as patients come in and they tell me about their issues, what I've found myself doing is expanding my practice to meet whatever they need. And that has started to include nutrition and functional medicine. Functional medicine looks at physiology and the things that help physiology along, and then giving the patients the supplementation that they need to boost their physiology. I do a little bit of environmental medicine, which is looking at patients' environments and things that they may be sensitive to, like formaldehyde in carpet, for example, or maybe a patient's allergic to milk, and no other physician has found that. So we go hunting and try to sort that out and get their allergies taken care of, which is what's kept them from healing. I also do clinical homeopathy, so using homeopathy for specific symptoms, which is different than classical homeopathy, which tends to target someone's constitution, or another way of looking at it is kind of the way they show up in the world. I do prolotherapy, which is short for proliferative therapy, which is a way to treat stretched or torn ligaments, tendons, and fascia and actually get them to regenerate. I do neurotherapy, which is a way to address trauma that's been stuck in the body, in the nervous system, and to help that release and get people to kind of settle down back to normal. What can happen is, for example, if you're in a car accident, your body doesn't see the difference between that and being chased by a saber-toothed tiger. And if it doesn't recognize that the threat is over, effectively you've put your foot on the gas pedal of your proverbial car and you can't take it off. So we work on trying to get your foot off the gas and try to bring you back down into neutral, so a standstill with no foot on the gas, no foot on the brake. I also do mesotherapy, which is short for mesoderm, and it's using either Western medical pharmaceuticals or homeopathic medicines and injecting them straight into the mesoderm, which is one of the layers of the skin. So it's a very small needle, going a very short way into the body. But the interesting thing about it is the medicines can actually penetrate downward and reach tissues that you may not be able to reach with a needle. And you can use it for traditional pain relief. And you can also use it for things like weight loss, which we're beginning to develop here at the clinic. I do cranial manipulation, so work specifically with the bones of the head. I also am one of the few people in the country to also treat the brain tissue itself. So for things like post-traumatic stress disorder, traumatic brain injury, seizures, I can put my hands on the brain, come up with a diagnosis of the structures in the brain, and work toward returning those to normal. I treat all of the viscera in the body, and the viscera are the organs, so that can come in handy for things like infertility and gallbladder disease. I also do osteopathic eyeglass examinations where I put my hands on someone's head and literally give them an objective, so this is not subjective where they're saying this is better, this is worse, but objective in that we're looking at it from a standpoint of the bones in their head, and we put a glasses prescription on them that keeps their eyes from having to strain. I do dental evaluations as well, so if you're going to go in for orthodontia, I can work with the dentist and make sure that the braces that you get don't cause your head to stop moving, which can cause things like headaches. And that treatment can actually keep you in orthodontia for a far less time than if you didn't have the treatment. And then as a spin-off of that, we actually do bicycle fittings as well. I've done work with quite a few what I would consider recreational and kind of semi-pro riders, and all of the feedback that I get from them is absolutely wonderful. And I'm also working with some runners on fitting running shoes. The best way to know if you're a good fit is to actually call the office. The number here is 317-228-9270. And talk to the receptionist because they get to see who comes in and what happens. So they have a pretty good idea of what your condition is then once you tell them and if you're going to be a good fit for the office. Another way is to go to the website, which is www.osteopathicvision.com. I continue every new patient that I see that comes in that's been to see other physicians and they haven't been able to get them where that patient wants to be, is a challenge and an opportunity for growth. And so as I learn more, my practice continues to expand. And so I see that continuing to happen in a year. And as word gets out that I'm here and people tend to show up, they tell their friends and family and coworkers, and so the practice continues to grow. So I'm hoping that it gets full pretty quick.